Well, common causes of hair loss and thinning is genetics. As we start to age, we see receding hairline, but there's also much more than that. Nutrition plays a big factor. We use supplements from companies like Nutrafol that, have targeted micronutrients that can help with hair growth. Thyroid abnormalities are extremely common with hair growth and hair loss in men and women that see thinning, or when I'm in the shower, it's coming out by handfuls. Well, those kind of things are alarming. We also, our hair goes through cycles of growth. And so it's not always a pathologic condition. Sometimes it just happens. But we have to start certainly making sure we're optimizing our diet, our nutrient intake, having things checked like our thyroid that can affect hair loss significantly and hair growth, and then make a plan. It's fairly simple to use things like platelet-rich plasma, PRP. We have a number of excellent growth factors in our own blood that can be separated, spun, and re-injected into the areas to stimulate hair growth. We do stem cell therapy. We use exosomes. And so there are several high-level type of treatments long before someone would want to consider a hair transplant, let's say, or just throwing the towel in and shaving. So there really is a lot that can be done, and it is rewarding when we can make an impact on someone. Certainly, we can't overlook addressing hormone balance, because that too can be an important factor. Well, from my standpoint, the most effective technique for hair restoration is using exosomes or stem cells. The platelet-rich plasma works as well, and it works very well, except that we have to have more frequent treatments and then once or twice a year to maintain that with exosomes, because of the number of growth factors, really several hundred proteins, growth factors, messenger RNA obtained from perinatal tissue safely from pre-screened donors at the time of birth, versus a dozen or so good growth factors in your platelet-rich plasma. So it's a decision that we have to make one case at a time, and depending on the severity of the condition and what someone's goals are. And I'm very cognizant of budget. And so we want to make sure it fits the person, that they're comfortable with what we're doing, and we look for the best results possible. Well, the procedure for hair restoration using platelet-rich plasma or exosomes is really the same. Sometimes we use a numbing cream on the scalp. We use a very small little 31 gauge needle. We go 2 to 3 millimeters deep into the tissue of the scalp. And so it's not a painful procedure. It can be uncomfortable. The numbing medications do seem to help. But I've had some that said, hey, let's just get it over with, inject me. And so we do it in a grid-like pattern, every centimeter and a half apart, with a tenth of a cc, let's say, of product of PRP or exosomes, so that we really encompass the entire area involved in the scalp. And sometimes, it's from front to back. Others, it's, occipital or posterior hair loss. And so, we just go to the area that needs it and infiltrate that area with a good concentration of proteins and growth factors that will stimulate dormant hair follicles, help make the hair follicles that are there even healthier. We see thicker, more vibrant hair following these kind of treatments. It's kind of like fertilizing the lawn, so to speak. I think we see the best results when we start early. So there's no question. When you're starting to see thinning at the front of your scalp, or towards posteriorly in the back, or over the crown of your head, which those are hereditary patterns as well. But to stimulate dormant follicles, or those that are kind of falling off, we want to make the environment for those hair follicles as rich as possible. And so starting earlier may take less treatments, series of exosome injections. It really is very individual, but I would say sooner is better in this case, as it is with many things. We don't, it's much harder when I have someone come in with fairly significant baldness. We're not going to grow back all that hair. And it becomes much more difficult when it's been present longer than 12 to 18 months. The results are not as good. So in this case, being an early adapter, doing something earlier to see how you respond individually, choosing what makes the most sense in your budget is the best way to go, in my opinion. Well, I think one of the important things to maintain good results is not to poison yourself with nicotine and excessive alcohol, to eat a healthy diet. We usually send people for a supply of Nutrafol vitamins. And also, as I said, we've addressed other issues. If there's thyroid therapy that's needed ongoing, that's pretty simple to do. So we want people to be as healthy overall as possible, and then plan some simple follow-ups to continue to stimulate and see the results of healthy hair follicles and healthy head of hair.